Hi, my name is Andrea Kisme. My topic is calcitonin-Guided use of antibiotics for lower respiratory tract infection. Defin- Definition: Procalcitonin, precursor of calcitonin. Lower respiratory tract infections are often treated with antibiotics without evidence of clinically relevant bacterial disease. Serum calcitonin precursor concentrations, including procalcitonin, are raised in bacterial infections. We aim to assess of procalcitonin-based therapeutic strategy to reduce antibiotic use in lower respiratory tract infections with a new rapid and scientific assay.
Lower respiratory tract infections. Overview. Lower respiratory tract infection or LRTI is an acute infection of the trachea or windpipe, airways and lungs which make up the lower respiratory system. Lower respiratory tract infections include bronchitis, bronchiolitis, croup or laryngotracheobronchitis and pneumonia. Symptoms. Main symptom is severe cough with phlegm and mucus. Sometimes the mucus may be blood stained. Other symptoms of a lower respiratory tract infection include a tight feeling in your chest, breathlessness, wheezing, sore throat, headaches, chills and fever, aches and pains, irritability and lethargy, vomiting along with cough, blocked nose and sinuses. Causes. These infections are caused by bacteria, viruses or fungi. Viruses causing respiratory infections are highly contagious and they disperse readily via direct contact. Recovery time. Symptoms of lower respiratory tract infection usually resolve without specific treatment or investigation in a median of 3 weeks. Food and nutrition. Foods to be taken. Foods rich in vitamin C and E and minerals like zinc and selenium are good for respiratory infections. The vegetables that have the highest value of vitamin C are peppers, cauliflower, watercress, tomatoes, cabbage, peas, broccoli, potato skin, and spinach. Fruits high in vitamin C like limes, grapefruits, strawberries, melons, kiwi, oranges, guava, papaya, mango, and tangerines. Foods rich in vitamin E include sunflower seeds, peanuts, hazelnuts, and almonds. Fish have the highest amount of vitamin E, especially sardines, tuna, and salmon. Nuts, fish, wheat, rice, oats, peanuts, etc. have high amounts of zinc and selenium. Avoid foods that weaken the immune system. Refined and processed foods, dairy and high fat products, sugar and high sugar products, alcohol and tobacco products. Exercise and yoga. Do deep breathing exercises. Yoga and pranayama will improve the overall functioning of the respiratory tract and alleviates the symptoms of breathlessness. Call a doctor if you feel very weak, are unable to breathe properly, have severe cough along with mucus and phlegm, and have chest pain. Prevention. Get vaccinated with influenza vaccine yearly. Quit smoking as smoking damages lungs. Maintain hygienic conditions. Follow a healthy diet. Avoid foods rich in fats. Washing your hands regularly and thoroughly, particularly after touching your nose or mouth and before handling food. Sneezing and coughing into tissues. Throw away tissues immediately before washing your hands and do not share anything used by infected persons.
Applications in medicine. 243 patients admitted with suspect lower respiratory tract infections were randomly assigned standard care of procalcitonin-Guided treatment. On the basis of serum procalcitonin concentrations, use of antibiotics was more or less discouraged or encouraged, respectively. Revelation was possible after 6 and 24 hours in both groups. Primary endpoint was use of antibiotics and analysis was by intention of threat.
Hi, this is Eric. This is episode 22, and we're going to talk about lower respiratory infections, basically pneumonia. All right, so what is pneumonia? This is an infection within the lung. It can be from a variety of different things: bacteria, viruses, fungal infections. You can even get some chemical pneumonias. So there's a lot of different potential causes. Now, I've really struggled with this. With this video, I had way too much in there and had to pare it back, and so if you're in the medical field, you may find this to be a little bit of an oversimplification, but I'm not trying to make physicians out of everybody. I just want to give a foundational framework for people to build off of. So here's a picture. The infection is typically localized to one area of the lung. There's a few pneumonias that can be everywhere on both lungs. Those are going to be something really bad. But most of the things that we think about as pneumonia are localized infections within the lung. Now, if you happen to get a chest x-ray, this is what it might look like. The yellow arrow points to normal lung tissue. The black of the aerated lung is easy to see. The red arrow points to a white density, a white area that's the x-rays don't penetrate through, and that's filled with liquid or pus, and that's what a pneumonia looks like on the x-ray. The lung tissue should look exactly like it does on the opposite side, and so you can see a very clear difference there. Now, what are some symptoms of pneumonia? Obviously, a lot of people will have cough, and the cough is frequently productive, although it doesn't have to be. Fever goes along with pneumonia, and fever is defined as a temperature greater than 100.5 Fahrenheit. Some will have sweats and chills to go along with that, and very often you'll have what's called pleuritic chest pain, and this is pain that's present when you take a deep breath or coughing. You have this sharp pain within the chest. In severe cases, pneumonia can get short of breath, and then, like a lot of other infections, you can have some global symptoms like fatigue or malaise. Malaise just means I don't feel good. Now, on exam, what can you find? Well, you can find either an elevated temperature or a low temperature. Low temperature actually more worrisome. People that have hypothermia have a much higher rate of mortality. You can have an increased respiratory rate. Again, a normal adult rate is somewhere between 12 and 20 breaths per minute. Your heart rate can be fast. Again, a normal adult heart rate is typically less than 100 beats per minute. Or you can hear stuff on a stethoscope with abnormal lung findings. Now, there's a variety of different things. We can say rhonchi or rales or vesicular breath sounds and these types of things. But what I would do is I would just get a stethoscope and I would listen to as many normal lungs as you can. Listen to your own, listen to family members, and just learn what normal is. Because even if you don't know what to call an abnormal lung sound, when you listen and you're like, that's not normal, you'll be at least able to detect what's normal and what's not normal. Now, let's talk about bronchitis for a minute. Bronchitis is not a lower respiratory tract infection. This is an upper respiratory tract infection. But how do you tell the difference whether you have bronchitis or whether you have pneumonia? Well, bronchitis is typically a cough that lasts for several days, as much as 2 weeks. It can be as long as 3 weeks. The cough can be productive. And again, color of the sputum, color of your loogie that you're coughing up, has nothing to do with bacteria presence. All right, this is just simply cells, and so you can have shedding of your epithelial cells within the bronchial tree, and that can give a discoloration to the mucus. So when people say, well, I'm coughing up green stuff, that doesn't mean anything related to whether or not bacteria are present or not. You can get bronchospasm, which is kind of an asthma-like thing where you get some wheezing, some spasm of the bronchus. And if you have fever with bronchitis, then that would probably
Pros and cons. Pros. Highly sensitive immunoassays addresses confirmed factors, non-closure cooperation with RCT pro-host. Cons. As low compliance, experienced centers use diverse antibiotics prescribed weekly email for improvement. Issue applied in Ecuador. From November 2014 through May 2017, a total of 1664 patients were enrolled and underwent randomization, 8 rescued withdrawal, leaving a final analysis cohort and 1656 patients. A total of 1430 patients completed follow-up, 1345 completed third-day follow-up, and 85 completed 50-day follow-up only. Baseline characteristics were similar among patients who won't complete 30-day data were available and those with incomplete data, as well as in the two treatment groups.
I'm Dr. Richard Gannan. If you're looking for antibiotics for respiratory infection, that answer almost comes in layers. Will antibiotics treat a respiratory infection if it's bacterial? But 90% of the time, an upper respiratory infection, so you can consider that something above the neck, like a cold, like sinus stuffiness, sore throat, 90% of the time that's a virus. And it's going to go away in 7 to 10 days, whether you take an antibiotic or not. So you don't really want an antibiotic. It's not going to make you better any quicker. But you can start to breed out antibiotic resistance. So give it time. Indications for an antibiotic for an upper respiratory infection are if you don't get better after 10 days, or if after day 5, instead of starting to do better, you crash and burn and you're doing worse. And at that point, go see your doctor. The antibiotic will differ. Most penicillin-based antibiotics work fantastic. And then the doctor will pick your antibiotic depending on the antibiotic resistance in your community. Augmentin comes as a generic. It's a penicillin-based antibiotic. It will knock the snot out of anything in terms of sinuses, throat, ear infections. If it is a lower respiratory tract infection, so consider that below the neck, and we're talking a bronchitis or we're talking a pneumonia, there are some other antibiotics that are a little bit more effective. There's a family of antibiotics called the macrolides, and some brand name antibiotics, erythromycin or other things in that family, such as azithromycin, you might recognize that as Zithromax, work well. And then there's a whole nother class of antibiotics in the cephalosporin family, and there's too many to list off. There's about 15 or 20 of them. So much of the choice of antibiotics is going to depend on what the resistance is that's in your community, whether we're going first line or second line, the cost, your insurance coverage, and whether or not you're allergic to anything, and your tolerance, because some antibiotics are going to have different side effects as well. So let the doctor pick that. That's what he is there for. But if your symptoms are mild, you just recently got sick, most of your symptoms are above the head, give it a week to run its course. Take things over the counter just to treat your symptoms. But if after day 5 you're doing worse, go see your doctor. If you have a high fever, go see your doctor. If you think you have the flu, that's one reason to get on an antiviral. That's not an antibiotic. But get on an antiviral within the first 24 to 48 hours, because a medicine like Tamiflu can knock the snot out of it. But recognize the flu is a viral pneumonia. You have symptoms of pneumonia. So I hope that helps. That's an awful lot, but it's not a cut and dry answer when we're dealing with antibiotics. One of the reasons I got into medicine and started doing videos is medicine is very gratifying because you can really, really help people. And when people leave your office, you've made a difference in their life. And more recently, I found a great way to make a difference in people's lives outside of medicine. And I've teamed up with some internet experts that are simply brilliant, and we're helping people save money. And for those that choose to, you can make money by helping people save money and make an awful lot of money. If that's something that sounds like you're interested, click the link below. It'll take you to an opt-in page and then a video which will explain everything that we're doing in about 45 minutes, and you have a complete understanding. So I hope that helps. If you're getting sicker and you need your physician, don't hesitate to go.
Conclusion. The provision of procalcitonin assay results, along with instructions on their interpretation to emergency department and hospital-based clinicals, didn't result in less use of antibiotics than did usual care among patients with suspect lower respiratory tract infection.